But to get to the bottom of what we actually know about it scientifically, what we know about these vaccines, I want to bring in a scientist and a doctor that is one of the greatest in the world that has been doing just that. I'm talking about Dr. Peter McCullough. He just appeared at the event I had there in England at the Better Way conference, and I think what he said there was prophetic to the situation we are discussing right now in monkeypox. Just take a listen to this.
What we're seeing now is the utilization of vaccines as an inroad to global human compliance, subjugation of the entire world's population at the same time via the same method. Subjugation, having our rights linked to the end of a hypodermic needle. That's the common theme.
That was Dr. Peter McCullough just moments ago at the same conference I was at in the UK in Bath, England. Obviously, I'm just excited to have Dr. Peter McCullough just moments after that to talk about the monkeypox. So, Peter, you know, my first question for you is, as soon as you saw this monkeypox thing, I know what was running through my head. I mean, for me, it was just like, oh, come on. But what was your thought when you saw this headline starting to sweep the world, really?
It's here we go again. That was the first thing I remarked on. But, you know, quickly as a doctor, I do have to be prepared. And, you know, brief review, monkeypox is in the orthopox virus family, double-stranded DNA virus. There's cowpox, smallpox, camelpox, and monkeypox. It's a pustular rash, basically. It's transmitted through the pustules, the blisters on the skin, and through the saliva, close facial contact, kissing, sexual contact. It was discovered in 1958, first human case in the 1970s, U.S. outbreak in 2003, when prairie dogs as pets were mixed with giant pouch rats from Africa, the Congo Basin. That's where this emanates from. And then humans contracted it. Importantly, no deaths in that U.S. outbreak in 2003.
So my first question,
and then a huge literature developed. Yeah, a huge
my
literature
first
developed.
question then is: there's a lot of people that will say this is just like, what about, you know, we're seeing these herpes that are, I mean, the herpes zoster, the you know, shingles and chicken pox, you know, they're going to try and make that the smallpox or something, but they're different viruses, right? They're not even in the same family. Like, there's a big difference between a chicken pox and, you know, these monkeypox, cowpox, and things like that. Correct?
Yeah, there's no doubt about it. They're different skin lesions. They're larger, more pustular. They involve the palms, which very few rashes do that. But there's actually quite a literature on monkeypox because it's related to smallpox.
And obviously we hear smallpox. That's a terrifying, you know, horrible thought. When we talk about vaccination, you know, the one thing you always hear when people say, like, I'm starting to delay some of my vaccines, or I'm hesitant, I don't want to do it, we hear smallpox and polio. We've eradicated smallpox, we've eradicated polio. That's what vaccines are for. And so, you know, when we start hearing pox, it's very scary, right? It's a lot, you know, as soon as we start thinking about lesions and things like that and attributing to smallpox. So the monkeypox, they've been around. You're saying that the last outbreak was not deadly. Have there been any outbreaks of, you know, is there a strain that we've seen of monkeypox that was deadly?
There have been some deaths attributed to monkeypox, you know, over the decades. You know, there have been thousands of cases, most in Africa. The deaths have occurred in regions where there's little or no health care, or in advanced HIV, in younger men with advanced HIV who are already ill. But the reason why this is such a big deal is because there's an effort afoot to counter protect against smallpox or even monkeypox bioterrorism.
Right. We have, you know, the sort of this idea that we're already hearing, right? We're already hearing that they're going to order vaccines and things like that. But before we get into it, I just want to really understand this virus. You're saying it's not deadly. How contagious is it? Because my understanding is monkeypox is very hard to transmit, yet we're seeing, you know, multiple countries, and not even countries that share borders. This thing just sort of all of a sudden starts appearing around the world. There's something suspicious about that, or am I just missing something?
You're right, it's very hard to transmit. And as evidence for this, the CDC told us about a case here in Dallas, Texas last summer, Del. A man from Africa traveled to Atlanta and then to Dallas, and he had many, many contacts. He developed this pustular lesion. He finally was hospitalized. He was given the FDA approved drug called tecovirimat or TPOX. He did perfectly fine, but importantly, the CDC has a monkeypox response team. There was nearly 36 authors on this paper in MMWR, which just appeared last month in April of 2022. Importantly, they checked every contact, and despite him having the illness, not a single person contracted it, not a single person. So it's very hard to transmit, has an R naught way less than 1. And so what this means is that it takes a lot of contact, like I say, kissing, sexual contact, touching the lesions. And so there are some reports now coming out of Antwerp, Belgium, in Europe, that it may have actually been transmitted at some sex raves or orgies.
Well, I mean, I guess that's one of the side effects of, promiscuous, sexual interaction, hepatitis issues. Those are the types of things that, those are the types of people that are at high risk. I'm not going to tell anyone how to live their lives, but, that would be a high risk group for these types of illnesses. So then, so is the understanding, we think it was a bunch of people at a rave that then flew back to the different countries they were from? That is how this suddenly sort of got into, I think nearly, right around a dozen or so countries right now so far involved in this.
We really need confirmation. I've seen at least 4 sets of fraudulent internet reports where they're actually using old pictures from several years ago almost as a scare. I think everyone should have some healthy skepticism. In March of 2021, the Nuclear Threat Initiative, which is a think tank out of Washington, met in Munich with the Munich Biosecurity Group, and they did a monkeypox bioterrorism tabletop exercise. This is the timeline in the report from NTI, and the release date of the monkeypox outbreak is scheduled in May of 2022. Almost, according to the schedule of when we started to see the monkeypox cases being reported.
Wait a minute, another sort of Event 201 type scenario where they were gaming out a potential biological threat or release that could sweep the world, and their scenario starts a year later in May of 2022. I'm starting to wonder, are these people psychic? Do they know something we don't know? Or are we somehow, is this like the ultimate proof that what you fear you draw upon you? But it is really bizarre, that timing. And so when they ran this scenario, what was the results? What kind of numbers were they looking at when they went sort of worst case scenario with monkeypox?
They had conceived of a scenario where the monkeypox would not be responsive to a vaccine. And there would be many millions who actually die of monkeypox. The numbers were extraordinary that they cooked up. But I can tell you, the release date of May 15th, that's just a week before the WHO meeting on the global treaties for pandemic response, and right just before the Davos meeting for the World Economic Forum. The timing of this would make anyone naturally suspicious.
Right. It really is very suspicious. And here's what's also suspicious, because before we started, I played, sort of the similarity in this moment we find ourselves in to just at the beginning of coronavirus. They were downplaying it, Tony Fauci saying, this really isn't that big a deal. Americans don't need to worry about it. We're hearing very much the same thing now around monkeypox. And you and I both think, that should be the case. And it should have been the case with the coronavirus, by the way. That ended up having a death rate of about 0.26% across the world. It fluctuates a little bit depending on what age group you're looking at. In my mind, not worthy of the level of extreme lockdown, shutdowns, denial of access to proper medical care, total government control of doctors. None of that should have happened with the death rate that had. And this feels so similar. It's again, almost a benign disease that will be bad for maybe a very small group of people, but we're hearing the same language that it's really not that big a deal. And what's bothersome about it for me, Peter, is Why did they pick this monkeypox a year ago? So a year ago, you have a major gaming of monkeypox in particular, and then ironically or prophetically 1 year later, it's monkeypox that comes out. But then the first knee-jerk reaction is to say, oh, go back to sleep, everybody. This isn't a big deal. I mean, we only gamed it as like wiping out millions of people last year, but we're going to tell you right now it's not a big deal. There's just something really stinks in how this is all lining up.
But to fill out the information, there has been some planning for this. So there actually is a smallpox, monkeypox medicine called tecovirimat, known as TPOX. Right. It's oral, it's safe and effective. And just a few days ago, our FDA has approved it for intravenous use. So this case that landed in Dallas last year, he got tecovirimat. So it's safe and effective. It inhibits a cell surface receptor for the virus, and looks very good. It's got some drug interactions, but it inhibits the VP37 receptor, and it can easily manage. So it's available to us. The U.S. has a stockpile of 2 million doses of this. But shockingly, when the monkeypox story started to evolve, we heard a report that the U.S. government had actually purchased 13 million doses of the Jynneos vaccine. The Jynneos vaccine. So wait a minute. The Jynneos vaccine was coming along in 2018, 2019. And in fact, this is a live attenuated vaccine. And with it, in a study of over 3,003 people in the package insert, you know what the trouble is? Myocarditis, or heart inflammation. And now there's already reports of heart inflammation with this vaccine. Kenneth and colleagues reported in 2018 heart damage with the product in a young man aged 36. Now, the interesting thing is clinically, now, the people who are at risk for dying are young individuals with HIV. We can't use live attenuated viruses in people with HIV because they're immunocompromised.
Well, let's just stay right here for a second, because I want to jump into the idea of being immunocompromised in just a second. But we ordered 13 million of these vaccines. Now, is this the same vaccine I was seeing headlines on last year that could be used for smallpox also, this live attenuated vaccine? And I'm like, wait a minute, why are we introducing a live anything with smallpox or pox, especially like an eradicated disease? Why would you start messing with that? And so we have 13 million of these vaccines, and you're saying the known side effects, and the numbers are fairly high, right? In the trials of this vaccine, they had pretty high issues of myocarditis, and then I believe troponin levels. Is that correct?
Right. So up to 18% had elevations in cardiac troponin. This is worrisome for subclinical myocarditis. We know that the smallpox virus itself has some tropism for the heart. And so the last thing we want to introduce is a live attenuated virus that in fact would cause heart damage in ostensibly well people. There have already been case reports proving this with MRI and other clinical sources of data. So the U.S. pulls the trigger for this. And actually the former FDA chairman, Scott Gottlieb, was on CNBC the other day advising on what's called perimeter or rim vaccination, meaning if there's a monkeypox patient, anybody who's in a rim of exposure contact, that they would take one of these vaccines. Now, the vaccine has to be given at shot number 1 and then 4 weeks, shot number 2. It's obviously going to be too late for any type of protection for someone who's come in contact with monkeypox.
So do you think they're going to use this prophylactically if we see a few more cases starting to spread? I mean, that's always my concern. The truth is, Peter, when it comes to vaccinations, if you're using it as a treatment, if you're using it for a very specific group of people that are maybe going into a very high-risk situation, maybe a doctor that deals with blood all the time and are worried about hepatitis B, that's one thing. But like giving a hepatitis B vaccine to children that aren't going to have no risk in it as babies, that's where I start having an issue. And so I'm really concerned. If there's risk to monkeypox, look, if you work in a zoo with monkeys or whatever, I mean, like however this works, that's one thing. But do you think we have a risk where they may start prophylactic delivering this vaccine?
I think the vaccine would be certainly a greater risk than ever getting monkeypox. I agree. If they had monkey handlers, veterinarians trappers, other people in the Congo basin, if there was a reason to get to the source of it, it always comes out of the Central African Congo basin. That's where it emanates from. I wouldn't have any problem with that. But I'm deeply concerned that, Americans are going to be petrified. And, another important point is that the smallpox vaccination program phased out in 1976 in the United States. Smallpox vaccine in a paper by Beer and colleagues published in 2019 clearly provides protection against monkeypox. So here, anybody over age 50, Del, they're already covered. And so I wouldn't see any reason for those individuals to get the monkeypox vaccine. I did notice, though, in the Jynneos program, they went ahead and tried the vaccine in people who had already taken the smallpox vaccine, again, with this intent of almost over-vaccinating somebody.
Okay, so now let's get to what I think is really my concern, and something when I first was looking at this, of course, I jumped to, are they just pushing another sort of fake pandemic, whatever it is? You can never prove it. I'm not a conspiracy theorist, but I'm super skeptical for all the reasons you've already pointed out. But we are in a different scenario here. So much of our reporting, I know much of your investigations has led you to many of the same conclusions. A lot of the strong statements being made by Dr. Ryan Cole, looking at the toll-like receptors. We know that this coronavirus vaccine that we just gave to hundreds of millions, really over a billion people around the world. Many of the first world nations where we're starting to see this thing have very high vaccine rates. Here in America, well over 60% have gotten, 2 of these vaccines. And if the side effect, in fact, the design of this vaccine is to shut down the toll-like receptors, to affect your T cells, all of this in a space. And we're even hearing mainstream media recognize, even Dr. Jennifer Ashton said on the news just last week, you should really think about that 4th booster, because a lot of the reports and the problems with the 4th booster is immune exhaustion, or some description of the immune system just giving up and shutting down. And it's not just shutting down for coronavirus, it's shutting down for, it's why we're seeing herpes zoster, we're seeing the shingles as a side effect. Clearly the immune system is being suppressed by this vaccine. So when you say that the monkeypox is really at risk for people suffering from HIV, it's kind of amazing that when we talk about immune exhaustion and an immune system, that's been wiped out by the coronavirus vaccine, we're not hearing compared to HIV and AIDS, but essentially that's what they're saying, isn't it? We're talking about, an acquired immune deficiency. In this case, acquired by the previous bunches of COVID vaccines you had. Is it possible that monkeypox, or even other viruses that tend to not be a big deal in a population that maybe have a really deficient immune system caused by the vaccine campaign we just went through, that we could see this start to spread in communities outside of gay communities where, HIV and AIDS is much higher?
We are seeing examples of a second hit hypothesis. This is what you're bringing up. That is, the first hit being SARS-CoV-2, whether it be the respiratory infection or the infection plus multiple doses of the vaccine and getting loaded with genetic material and spike protein. But one of the first examples of a second hit problem is the pediatric outbreak of hepatitis. And there, in a paper in Lancet Hepatology, Broden and Arditi published a paper summarizing the data, saying that what's at the base of this is called spike protein superantigens. And there the children have either gotten COVID-19, been exposed to the vaccines, or parents been exposed to them, and then they get adenovirus 41 and develop a very serious form of hepatitis, some leading to transplant or death. We have now a clear track record of varicella zoster reactivation after COVID-19 and the vaccines, and now Epstein-Barr virus reactivation. And you're pointing out something even more, I think, important, that there's a term that's been generated called vaccine-induced immunodeficiency syndrome. Now, it's not HIV, it's not AIDS, it's not the HIV virus, but it's like HIV, where we see acutely there's lymphocyte depression, there's impairment of the immune system, and in fact, there's even impairment in the immune system of fighting off COVID. So we're seeing worse cases of breakthrough COVID in those who are most fully vaccinated. That's supported in the literature. A recent paper shows that those who've been vaccinated, they have a less robust immune response against all the epitopes of SARS-CoV-2.
So when you now, as a doctor, I would think there's almost like two personalities going on. Through everything that we've all been through in this pandemic, you are obviously as mainstream as it gets. You're the most published doctor on the coronavirus itself, the most published heart specialist in the world when it comes to all these other, the medical knowledge you have. But on the one hand, you're here telling us, don't worry, folks, monkeypox is really not that big a deal. It doesn't tend to cause deaths. It shouldn't spread that fast. This is probably a bit of an alarm, going off that it could be over the top. But on the other hand, when you look at the health of the world after coronavirus, and even more specifically what we're talking about, after this massive corona vaccine program where they have delivered 3 and 4 shots knowing it's suppressing the immune system, in some ways even on purpose, is there a part of you that this sort of wakes up a deeper concern for a real drop in overall health amongst those that have really taken a lot of these vaccines? They have this spike protein floating around their bodies. It's not a natural RNA. It's something that Dr. Robert Malone's talking a lot about. We didn't make the vaccine out of a natural human RNA. We put in the uridine. This is a special molecule. We don't know how long it's going to persist in the body. Do you have a concern? Does it make you look at this differently? Like, on the one hand, yes, I want to be able to treat monkeypox, but on the other hand, we may be dealing with a monkeypox on top of an immune system that has been hampered by a vaccine or previous infections that could take us into a totally different world.
It's certainly possible. 2 things come to mind. One is actually intentional release or spread of the virus, exactly what the NTI and Munich group thought was going to happen. I mean, that has to come to mind, right? They're doing this scenario to play this out. The CDC has a monkeypox response team, so we have to play out that possibility. And so if there was intentional release or intentional spread to cause harm, and we see far more cases than we would ever expect naturally, that has to come to mind. The second issue is, could the immune system of these younger people have been knocked down? We need good case data to figure out who's had SARS-CoV-2 and who's had the vaccine. We still don't know. The good news here, though, is it looks like the elderly, and I guess you and I potentially would be in this group, I called my mom to find out if I got smallpox vaccine, and my mom knew that I did. Me and my brothers, I can tell you, Del, we don't have to worry. We're protected.
All right, so to get into what you just said, though, this idea of a release, a purposeful release, or even an accidental release, this was at the heart of the coronavirus, the COVID-19 pandemic. Obviously, I got in a lot of trouble talking about lab origin. 2 years into this now, that's really the consensus, and not that consensus means anything, but we're all leaning towards it was a lab in Wuhan. Is there any suspicion that the monkeypox has been being worked at in any labs around the world, especially in the middle of this Ukraine-Russia war? We heard so much about those biolaboratories and the concern that what if Russia went in there? What if they blew it up, or people, ran out and were not protecting what was inside of there? Where are we at with monkeypox inside of labs? Have we been doing any work with monkeypox?
That's a very good question. In 2022, a paper has appeared by Yang and colleagues from the Biosecurity Lab Level 4 in Wuhan, China. So here we are, right back to Wuhan. Now here, the paper deals with development of PCR techniques for a segment of the DNA code of the monkeypox virus. But to answer your question more broadly, I don't see evidence of an intentional release. If you look at the case count over time, there have been thousands of cases, and cumulatively they're going up over time. There was this case in Dallas last year. No one made a big deal out of it. Took the CDC about 9 months to publish it. There wasn't a scare. It actually never even made the news in Dallas that I can recall. So I think right now, I think we're okay. It's just that too many things are a coincidence right now with monkeypox. And then the fact that this would rise to the level of a statement by our president. President of the United States puts out a warning that we should all be concerned about monkeypox.
Well, any last thoughts? I mean, as we watch this, it's so hard. We're not doctors, we're not scientists. We have a media system that just keeps repeating a very small anecdotal incident, which we then personalize. It starts ramping up our fear and our concern. I kind of wonder sometimes, whether these things are happening on purpose, like you said, even coronavirus, if there's like a litmus test where they're trying to see how stressed out we get, to see if they could hook us enough to really make another push to try and make this the reason we get the vaccine and get the vaccine passport and get ourselves signed up to that technology you spoke so clearly about at the conference in Bath. We know that's their agenda. They keep looking for that opportunistic moment. I mean, I guess I wonder, is it our reaction right now that determines whether they think they can turn this into a reason to engage in all of that technology they want to leash upon us? But for your average person out there, what do you think how should we be carrying ourselves right now? Should we be suspicious? Should we keep our eye on it? Should we forget it exists? How do you think we avoid being manipulated by these types of concerns?
I think it is a test of our hypervigilance. That's what psychologists say, that we are in a state of hypervigilance on microbial disease. In 2017, CEPI, the Center for Epidemic Preparedness and Innovation, formed by the World Health Organization, World Economic Forum, and the Gates Foundation, they created a business plan, and their business plan is published. It says that CEPI will look for opportunities. They name something like monkeypox as an opportunity, a business opportunity to come up with a response. And in CEPI, the only response to these business opportunities is mass vaccination. Right. And we saw the trigger pulled already for this company, Jynneos, with a vaccine that is, by the way, the Jynneos vaccine has never been demonstrated to prevent a case of monkeypox or camelpox or smallpox. It's only been approved based on antibody testing, neutralizing antibody testing. Jynneos just got ginned up with 13 million doses purchased by the U.S. government with no questions asked. What should people look for, though? Honestly, if you're traveling, you're seeing people here and there in the airport. If you saw pustular lesions, particularly pustules on the hands, you saw people who are sick in your circles, maybe you're at a clinic or you work with veterinarians or in zoos and elsewhere. If you saw something like this, have some awareness in terms of testing. Simply can burst one of the little bubbles on the skin and test the PCR of the liquid within the blister to find the answer. The CDC has the assay. And we have a stockpile of the medicine, the tecovirimat, the oral medicine twice a day is well tolerated. Again, we even have IV approved. Older people over age 50, I would not have any worries. I think now is the time to be reasonable. If these kind of sordid activities like sex raves and orgies and things of this nature, you can imagine someone covered in pustules. I think most of the time it's just being reasonable. A reasonable person is simply not going to contract this illness.
All right, let's talk about your book. Your book is releasing as we speak. Just tell me about it. The Courage to Face COVID-19. Seems like a good time to read something like that, because we're going to have the courage to face monkeypox, the courage to face whatever new coronavirus or flu. The news just loves to make us terrified about these things. So why did you write this book?
Courage is a key word, and I teamed up with best-selling true crime author John Leake, who's a medical historian, a forensic examiner, and we've worked together on it for a year. And John, through his careful review of the evidence in my struggles as a doctor trying to treat patients, we tell the story in a narrative format. It's the only book out there that's in a narrative format. And what John has convinced me of is that despite all our presentation of data, Del, and you do it great on your show, people actually better learn through understanding a story, reading a story. So this is the true narrative. of my journey and the journeys of people in my circle. We go all over the world on this through the well-documented Senate testimonies, other events that happen. John believes, and I believe, that the suppression of early treatment that created fear, suffering, hospitalization, and death was intentional, and it was designed to prepare the population to accept mass vaccination. And we believe that rises to the level of a crime, of mass negligent homicide, and we make the case in the book. And it's already hit number one, I think, in viral diseases, communicable diseases, and interestingly, true crime.
Wow, fantastic. So where do people get it? Where do we pick up the book right now if we want to read it?
Well, go to the website, couragetofacecovid.com, and read a little bit about it. And you click the button. That'll take you to Amazon. And we're working on some other distribution options shortly and an audiobook. But it's going great. We're very, very happy. The paperback is the bestseller. And it complements all the other major books out there. You know, Robert F. Kennedy has a terrific book focusing on Anthony Fauci. And this is going to complement. Has also patient stories. So there are patients and about their struggles, and we've interviewed these patients, and it's all true. It's all nonfiction. We've interviewed them, including some family members who gave the story of those who didn't make it because they were denied early treatment.
Well, Dr. Peter McCullough, thank you for taking the time today and sort of giving us a better understanding of what we're seeing in the news. You're so busy. You're doing such great work. Everywhere I go, you manage to find time to get the truth out there. So I want to thank you for taking time with us today, and I look forward to the next opportunity we have to speak.
Thank you.
All right, take care.